Hello, my name is Kevin Klean. I am a board-certified sports medicine fellowship-trained orthopedic surgeon at Crossing Rivers Health. So we actually do physical therapy before surgery and after surgery. And a lot of patients are like, well, why would I do therapy before I have to go do the joint replacement? But if you think about, it's kind of the old saying, you don't use it, you lose it. And a lot of patients, once they have a lot of pain and they have trouble walking, whether it be hip arthritis or knee arthritis, they start to favoring and compensating for that area of pain. And they actually, because of that, because they're kind of putting more stress across other parts of their body, they start offloading that joint. And because of that, we get weakness around that joint. And so if we do therapy beforehand, the stronger we make those muscles and the more basically tuned up the body is before surgery, the more quickly we rehab and the more quickly we recover after surgery if we do that beforehand. So a lot of times I'll have patients do some therapy and at least be taught how to do those appropriate exercises at home to make sure that we're doing some prehabilitation to increase that dynamic strength, support, and stability of that joint before surgery, because we know it's going to help us on the back end after surgery. And then our goal is with joint replacements, knee replacements, hip replacements, we want to get you up and walking the same day of surgery. We want to get you up, get you moving, working with a physical therapist to keep you on that course of postoperative recovery. We make sure that you're up, you're walking, that you're safe to move about so that we can get you home safely. And then after you're progressing well and you're through the kind of that acute phase of the surgery, then we get you to outpatient therapy. And most patients for a total knee replacement will be in outpatient therapy anywhere from about 2 to 3 months after surgery, just to make sure that we appropriately rehab that joint, to make sure that those muscles are firing like they're supposed to be. We make sure that that strength and endurance gets built back up, because we want we want you to walk normally, but two, we also want to make sure that we can get you back to those activities that you normally or that you normally enjoy, and that's kind of our whole goal with the surgery. And we want to make sure that we do that the right way. And so with the total hips, sometimes we do some therapy afterwards, depending on patient's activity level and the goals that they're, or the things that they're trying to get back to after surgery. But some people after a total hip replacement don't need as much therapy as a total knee, just because it's a different joint and it recovers differently, and there's a different time frame involved with that recovery. A lot of times that we have a little less requirements for therapy with the anterior total hip specifically as compared to doing a total knee.